Welcome to Oncology Radio. We are bringing you the latest information in the arena of oncology. Every episode brings you a new Maryland Oncology Hematology physician host, along with special guests in cancer research, new trials, cancer treatment, nonprofits, and cancer care. Maryland Oncology Hematology is broadcasting Oncology Radio from one of our 14 locations throughout Maryland. You can find Oncology Radio on Spreaker, iTunes, Google Play, Spotify, and iHeartRadio. So stay tuned and welcome to Oncology Radio.
Good evening and welcome to another episode of Oncology Radio. I'm Dr. Manish Agarwal. I'm the Cancer Center Medical Director at Aquilino Cancer Center. And today we're going to talk about the role of cancer support services in cancer care. And we're really fortunate to have a couple of great guests tonight. First one is Stephanie Stern, who is the Program Director for Hope Connections. And the second person is Kim Roddy, who's the Cancer Center Director at Aquilino Cancer Center. And so let's get into it. And before we start, Stephanie, do you mind telling us a little bit about yourself and where you are? And we'll ask Kim to do the same.
Sure. Thank you so much for having me. I am the Program Director at Hope Connections for Cancer Support, and I have been an oncology social worker for over 25 years. Just a little bit about Hope Connections. We're a nonprofit organization dedicated to providing support to anybody who's been affected by a cancer diagnosis and their loved ones. Our programs include support groups, mind-body classes, and educational workshops. All of our programs are professionally facilitated and offered free of cost. We offer over 40 support group sessions per month, over 60 mind-body programs per month, and close to 50 educational programs per year. We're physically located in Bethesda and Landover, Maryland, and we serve both Montgomery and Prince George's County. Since March, we're now located in one place, and that is over Zoom.
Great, thank you, Stephanie. Kim, tell us a little bit about yourself and where you work.
Yeah, thanks so much for the opportunity to give everybody an idea of what we do here at the Aquilino Cancer Center. So I, like Stephanie, have been in oncology administration for about 25 years now. And here at the Aquilino, we really put a focus on the whole person healing. And it really speaks to the heart of the mission. It isn't just about the technical portions of treating cancer, but we really want to put an emphasis on the emotional toll and the support that it takes for cancer patients when they are going on this journey and how it affects not just them, but their whole family unit as well. And there's a lot of services here that are important, and my role is really to help bring those all together to wrap around the patient and the caregiver. We provide like lymphedema services and physical rehab. There's medical oncology here and radiation oncology. We have a dietitian and nutrition support services. There's cancer navigation team and social worker, and we also have a psychologist. And then the latest addition is the focus on wellness with a wellness team. There's also a patient experience coordinator, because we believe so much in what we're doing and how patients feel when they go through our system here, that we have a person that's dedicated just to measure that and provide feedback. And the wellness services are our way of working in conjunction with these great partnerships like Hope Connections to bring offerings to patients and caregivers, in a way that they need it the most. And the other latest addition is the Bill Richards Center for Healing, which is a dedicated space solely around providing wellness for people.
Great, we'll want to hear a lot more about that. Before we get into all that, it may be somewhat obvious, but I would be interested to hear what you guys think about why is it important that patients reach out for cancer support services. I think probably that's not the first thing that patients are thinking about. They might think about, where do I get my surgery or chemotherapy and to think about the oncologist, but we're really talking about cancer support services, and sometimes that could be an afterthought. Why do you guys think that's important? Stephanie, do you want to go first?
Sure, I'd be happy to. I think support is so important, and one that oftentimes, like you're saying, doesn't get the same kind of attention. And I think that people put a lot of emphasis on how strong they are and that they can get through this themselves. And sometimes they're just so overwhelmed, they can't put another thing on their plate or even think about something else. But what happens oftentimes is that people really retreat and keep everything inside because they don't want to worry their family and friends, and they're still processing so much information all at once. But having a place where they can go and talk to other people who are in a similar situation really can be so helpful. Not only does it validate all their experiences and feelings, but it also, takes away some of that isolation that I think people just tend to, be alone in. So that this is a way to come together with other people who understand, who can be supportive, and together really share thoughts, feelings, and experiences, and lessen such a heavy load that I think people are really taking on. I also say to people that you can be grateful on one hand and feel a lot of other emotions on the other hand, whether it's anger, sadness, frustration. And even though we intellectually know that, I think a lot of times people don't remember that. So that these are also ways to be reminded of that.
So what would you tell a person that says, oh, that sounds all good and stuff, but I'm fine with my feelings and I just want to get through this, and I don't, does it really matter? Is it gonna, as long as I get through the cancer, I'll be fine. Is it gonna impact anything beyond right now? Is it just a bunch of people talking? I mean, why is it so important? Like, is it gonna lead to any better outcomes, or is my family gonna be better? Or am I gonna, like, why should I spend the time if I don't feel like I need it necessarily?
Sure.
Kim,
I think, Kim, I don't know if you want to answer that.
I do. I think that's one of the biggest things that we have really tried to tackle here at the Aquilino, because a lot of times it's almost like patients don't have a recognition that there's so much that's happening with them because they're so focused on the disease itself. And there's all these other dynamics that happen for them. And I think for us, some of the unique things that we've done is institute like screening in a way that every patient, every time they come in the door, because it also, it's a continuum where patients are okay and they seem to be doing okay in one time point. That can shift and change as other things happen in their lives or as their disease status changes. And I also know that there's times where they go through a whole treatment and then it's okay, great, you've gone through that, you've gotten through that, and now you have to go back out into your life, and your life isn't quote unquote normal anymore, and everything has changed around that, but they're so into what's happening and trying to get through that time period that there's not even the recognition that that's happening. So for us, it's important as the caregivers in this team to shine some light on that and find ways to invite people actually into what that healing process is as early as possible.
That's great, Kim. Thank you. Stephanie, do you have anything more to add to that, or I can?
No, I think it's wonderful, and I think it's so important. And what happens is things just start to seep out in other areas when you aren't talking about how difficult this experience is.
One thing I notice as an oncologist a lot of times is sometimes there's a little resistance, especially among us men. And so a lot of times I'll be in the room and it's clear that the patient is upset. But then when you bring up perhaps getting some support, there's a little bit of resistance. So what would you tell, Stephanie, someone that may sense that, but almost doesn't, it's sort of teetering whether to do it or not, or how to do it, because somehow there's this message that it's you're broken because you need help, or that you're asking for help, rather than, I try to frame it a little bit in saying that healthy people get help, and it's not that they're broken, but I mean, How would you
Well,
sort of talk to
I
someone?
talk about it in terms of lightening your load. And by talking about it, it doesn't necessarily change your situation, but even if it can just lessen some of these intense feelings, sometimes too, people have a hard time with words and sharing their feelings. But if they can hear somebody else put it into words in a support group, or meeting with somebody who's a professional, that sometimes that can really help them better understand what they're feeling and what they're experiencing. And there's no right or wrong way to go through a cancer diagnosis. I think that's so important that people realize too. It's just having the opportunity to share in a safe place where you don't have to worry if you're going to upset or scare somebody you care about with your feelings, to have a place to talk about them, and just to hear that it's okay to feel this way. And just because you say something out loud doesn't mean it's going to happen, or because you cry in this moment that you're never going to stop crying, or that you're so angry that if you allow yourself to be angry, then you're always going to be angry. Intense feelings and emotions tend to dissipate. But if we give them an opportunity, a place to share and to express ourselves, then we tend to free ourselves up to feel something else.
So if I'm a cancer patient listening and saying, like, how do I know if I should be reaching out? What are some maybe signals that say, maybe I should look into this a little bit more, or ask my oncologist, or call Hope Connections, or go to Aquilino and look on their website? I mean, what are some things I should be looking for?
Stephanie, if there's one thing because I know you have a whole host of information about that, but I think even if people are curious, and they're not sure, I think anybody on any of our teams would be willing to help somebody kind of sort through that, to get them connected into something that's right for them.
Absolutely. And just because you call us doesn't mean you have to participate.
Yeah.
I think sometimes too, just what's so nice now, given the pandemic, is that all of our orientations at Hope Connections, I'm personally giving everybody an orientation. So I'm calling every person over on the phone, talking through their situation with them, and deciding together what would be the right support for them in that moment. Some people aren't comfortable going into a support group, but they really want to take a yoga class. And they feel like, if I can join a yoga class with an instructor who understands somebody who's had a surgery or who's been through chemotherapy or radiation, then that's going to feel good to me. And maybe they come to support group a little bit later once they know more about our services. Or sometimes just even talking one-on-one to somebody helps them better understand all the benefits, and then they're more comfortable joining in. And I tell people all the time, I've been doing this work for 26 years, and that doesn't mean I would jump into a support group if I was going through something difficult. I know how helpful it is. I see it firsthand every day. But it takes courage to go into a group of people you've never met before and to share very personal information. So I think too, to just even validate that helps.
Yeah, and I think you hit upon something, that the support isn't just support groups. If people have questions about what are the right things to eat, or how can I help myself through this, that's where the nutritionist comes in. Or, geez, I might be struggling with some transportation. We have people here that will actually help with that and set that up. Patients don't have to go through these different areas and figure it all out on their own. That's what the support team does. There's so many areas where we can lean in and try to remove some of those burdens. It isn't just about talk therapy. It's actually about so much more than that.
So if maybe I'm not quite ready to sit in a group and pour my heart out, or even with a therapist, it sounds like there's ways to sort of maybe dip my toe in, and maybe, not to put words in your mouth, you're saying you'll meet me where I'm at, and it may be just simple things like questions I have around cancer, or things like that. It doesn't even have to be about feelings if I don't want to get right into feelings. Is that what you're saying?
Absolutely.
Yeah. And I think that's one of the great things about, some of the programmatic pieces that we've built in here, that we have educational classes that are geared just around that, so that the patients and caregivers that come through the doors can kind of get an understanding of what the full breadth is of what we do. And that's an easy way for somebody to kind of dip their toe in and see, because then they would meet the members of the team that all are part of these supportive services, get education about what's available to them, and then together could follow up and find out, okay, what might feel right for me, and what are the important questions I have right now.
Kim, tell me about some of the things that you guys have at Aquilino. Sounds like there are some neat services that you guys have in place, and could you highlight a couple of them? And
yeah, sure. I think that particular class, which is it's not just for newly diagnosed patients, it's for anybody going through a cancer journey, which is educational, that highlights all the different pieces that we have and what we're building here, is a great first step for people. And that class is actually called like the first step or the next step. And then we also have regular nutrition online classes for people. We have stress reduction and a mindfulness-based stress reduction class that we have here. We have yoga classes and movement classes. In addition, there are sharing opportunities, and we have counselors that are here. And then if there are pieces that we don't do here, this is where our partners are really important, because we can also direct people over into what Stephanie has at Hope Connections. And that's what our navigation and our support service team does, is they really try to make those different connections for people. And Stephanie, I know you guys have such a wide range of classes and services. Do you want to talk a little bit about what some of those are?
Sure. So we offer many support groups. Some of them are cancer specific, some of them are general cancer support groups. We also have caregiver support groups and support groups for the bereaved. In addition to our support groups, our mind-body classes include yoga, guided mindful meditation, hypnosis for symptom reduction, inner peace and healing. We have pink ribbon Pilates. That's not just, breast cancer, but that's a type of Pilates. Relaxation and tranquility, strength and balance, Tai Chi. And we also have a mind-body program. It's mind-body boxing, and we made it just for men because we recognize that men tend to not maybe want to exercise in a group of just women. That typically a lot of our, not that it's just women, but a lot of times men don't feel comfortable exercising with women. So we created this mind-body boxing program just for men, so that they would have something for themselves as an outlet, and that there's a lot of men that go to that class that don't go to support group, but that really find that to be a helpful outlet.
Yeah. And Stephanie, that's fantastic. And there's a couple other things that you kind of hit upon. For men and women, there's different things that speak to them, right? And so for one of the great services that we offer here is it for women that lose their hair. They don't have to go out and buy a wig. We have created community partnerships with places that will clean and refurbish these wigs. And then, when COVID's not happening, there are beauty schools that come in and help do hair and makeup and trim the wigs, so that these women can walk out feeling like a little bit of a sense of normalcy for themselves, which is really, that's a beautiful event. And we just try to find things that are going to speak to people. And then the other one that I think is really unique is our community resource specialist with Caring Matters. And she will go out and has done things like, their volunteer force is pretty amazing. If you need help getting your kids off the school bus, or you want somebody to come in and play games with you, like the sky is really the limit behind what that measure of support is. And I can't overestimate and speak to enough. Like, we really are trying to meet people where they're at, as you said, Dr. Agarwal, and really find out what support looks like for them and then meet that need.
It felt like there's a real collaboration between Hope Connections and Aquilino Cancer Center. Is that right?
Yes, there is.
Can you tell us about that?
Yes, I'd be happy to. We were so happy to partner with Aquilino Cancer Center. And at Hope Connections, we recognize the importance of connections with the community. So partnering with local hospitals and organizations is so important because we're really, all of us are stronger together. And like Kim said, I think, we complement each other on areas of support. So it's not one organization doing everything, that we share resources. And I think that's so important. So we together created a newly diagnosed support group because we recognize that newly diagnosed people and their loved ones oftentimes aren't the ones reaching out for support because they are incredibly overwhelmed and have so much to learn so quickly. And so this was an opportunity to invite them, just even based on the name, for them to know that if they've been diagnosed in the last 6 months, that they can come to a group with other people who have been newly diagnosed with cancer and really just talk about their thoughts, feelings, and experiences, and to really be validated in all that they're going through. And so that, it's a 4-week support group series, and it really just helps, again, alleviate the isolation, helps with validation, and really just people supporting each other. We've had 2 groups to date, and people have been very appreciative of the opportunity. And what's nice also too is that after that 4-week group session, they can go back to Aquilino and use their services, come to Hope Connections, and attend any of our support groups or other programs. So that this is a nice sort of introduction to. It's only 4 times, and it can be support, education, sharing tips, ideas. And so it feels oftentimes, I think, a little bit more comfortable than just coming into an ongoing support group, that this is really just meeting their needs.
Yeah, I think this collaboration has been really special for I know for me personally, but also for so many people that are here at the Aquilino. And it's because we recognize we can't do everything, but there are a lot of people that do provide these services and do it really well. So that's where the collaboration comes in, and for us to figure out what makes sense for us to be doing right here in the building, and then what makes sense for Hope Connections to be doing. And then how do we actually get the patients that are here over into those services? Because that is a big thing. And some people will naturally always go to try to find those out, but so many more don't, which is why things like what our screening are, our educational classes, that's why they're so important here.
I really like that vision because you're right, there's a spectrum of cancer patients certainly that I see, and some are very aware and then will seek out places like Hope Connections and might be more eager, and others are not even aware, and to have it maybe introduced at a place where they already feel that they're getting some care can help bridge that gap. And so that I like that you offer these services in a place where they're getting their cancer care for those that are maybe newer to this world. Stephanie, I was reading about you a little bit. I know you've done support groups for such a long time, and I wonder if you could share some of your passion and insight that you've seen in support groups. Why are they so powerful? And you've done it for, usually when people do things for a long time, either they have to or they, I bet you get a lot out of it. And I sense that
I do.
About this. Why are support groups so powerful?
I think it's really just the connections that people are making with each other that they don't even realize. I think it's only natural that when we walk into a room, now over Zoom, but that we size each other up. Is this person going to understand me? Does this person look like me? Is this person going to get me? And I think cancer evens the playing field because that's everything. It's this experience. and it's such a difficult experience. And even though most of us know someone who's been diagnosed with cancer, I think for most people it's a shock when it's them. And having a place to come and share with other people who really understand and don't feel like that they have to pretend everything's okay. And I think there's this internal pressure to be positive and external pressure to be positive. And when people come to group, I always say every time, this is a place where we invite the good, the bad, and the yucky. And I used to say the ugly, but I really think it's important that for everyone to know if something's going well, we want to know and cheer you on and be so happy for you. If you're not feeling well, if you're feeling worried, scared, just not, feeling good physically, this is the place to come and talk about it. And if things are really not going well, this is the safe place to come, and that we can hold this, and that we know if somebody's really having a hard time in group this week, that doesn't mean next week they're not going to be feeling better. And chances are that they leave group feeling so much better than they did coming in. And I have to remind the group that if somebody's super upset, that they're probably okay leaving the group. But sometimes the group members are left, feeling all that heaviness, and then they worry about that group member. But that chances are that person really does leave feeling a lot lighter, and again, frees them up to feel other feelings.
Yeah, this again reminds me of a patient that I had with pancreatic cancer, and he used to love going back into the treatment room even when he wasn't. And I would ask him why, and he goes, well, there's no BS there. He said, I can just be real. I don't have to explain anything. We just both get it on a level. And he found so much solace in going back and being with other patients. And it really sort of clicked that he felt like people got him on a very visceral level and without any explanation needed. So I can see what you mean. There could be a real deep connection there.
Yeah. And people are so much more than their cancer. There's so much more to share. And I think that, that there is something that's so important of being seen for who you are, and not in a way that I think people well-meaning will say, how are you? But do they even really want to know how you are? Or they say it in a way that just feels like something's wrong with you. And I just think that, again, that they're, like you were saying, Dr. Agrawal, that people don't have to pretend everything's okay, and that they can really be themselves. And that means so much.
Yeah, it's almost like a double stigma. Like one is a stigma of having cancer, and then the other one, it's almost like that you feel sad and it's not okay to feel sad or something. And so there's just some stigma around mental health. And so
100%.
And I guess you guys are working towards normalizing that.
Yes.
Yeah,
What we call the new normal.
that's right.
Well, Kim, tell me, you mentioned it briefly about this wellness center that you guys have built out. It seems like a pretty unique space. Can you tell us about this?
Yeah. So the Bill Richards Center for Healing that we built out is specifically designed to take care of the suffering that people go through and their caregivers in a cancer diagnosis. It's about 2,500 square feet, and it is got to do a lot. So there's a lot that the space can do. It is really beautiful, and we worked with, it's not a typical healthcare setting. It feels very calm and serene. It overlooks the healing garden, and it is a place for people to come and unwind. It also is specifically designed to to study psychedelics, which is the first of its kind in the United States, which is pretty exciting here for the Aquilino. And that's just one tool in a whole host of different modalities that we want to study to see what things, because people are so complex, actually make a difference in their healing journey. And I think this center is something that's going to really show people that it's not just words that we care about them. but we have taken the time and the energy and dedicated space in this cancer center specifically for that. So when we want to host a class or we want to host a beautiful U event, that can all be done up there. We can do group sessions, we can do educational talks. There's spaces and treatment rooms for Reiki and acupuncture and massage. I mean, you name it, we can put it in there. And this is, we're just in the beginning stages of what we're building around that. And for me personally, this is something that I'm really excited about because human beings are really complex. So nothing is off limits. If we can put sound healing in there, I mean, art therapy, the vision is to have many, many different things because we don't know where the healing is going to come from for people. And we want to give them a wide array of things to try.
I love the concept of having a healing center in the same building where you get chemotherapy and radiation. So that's part of care is all that. So I really like that a lot.
Yeah, that we really wanted to make it easy for people and to take the guesswork out of it, because part of what happens is when they're so focused on their care, to then say, oh my gosh, I have this other need, but how am I going to go and find it? And who's reputable and who do I take on? And how do I even start to go down that pathway to figure out where would I even start? So by putting the space here and the programs right here, at least it will give people an opportunity to know that there's things that they can try and that we have, we want to put reputable and safe modalities here. So it kind of takes the guesswork out for them.
Right.
And you're really showing that you're taking care of the whole person.
Yeah.
Yeah. It's
and
wonderful.
It's not just for the patients, it's for the caregivers. And then the other unique thing that we want to focus on is the people here in this building also that work here to take care of these patients. Like it's a lot for everybody. And we all want to be there and build this community to support one another.
You touched on something that I'd like to talk a little bit more about is a caregiver. There's a lot of, obviously the patient with cancer is going through a lot and we want to support them. But, certainly I see in our journals more and more talk about caregiver burnout and support for caregivers and the sort of this concept of maybe the unit, it's not just a cancer patient, but it's a whole family unit. And so Stephanie, can you talk a little bit about that? Do you guys have things for?
Yeah, sure. No, caregivers are so important. And sometimes I wonder if that's even the best word to use for our support groups, because I think people don't even realize that they are caregiving. And there's different types of caregiving. And I think sometimes people think unless they're, taking someone to the bathroom and, helping them in and out of bed, that then they're not a caregiver. But it's really anybody that you love who's going through a cancer diagnosis, and they don't even have to live in the same house or even in the same state. But it takes a huge toll, and we recognize that for sure. We have 2 caregiver support groups, and we also invite caregivers to our newly diagnosed cancer support group. Sometimes somebody is partnered or has somebody really helping them with their care, and sometimes people don't. So we really want to leave that in that group. It's optional. But our caregiver support groups, we have 2 that meet weekly, one in the afternoon and one in the evening. So we really want to be able to accommodate people's schedules. I think Zoom has made it a lot easier for people to attend, but they tend to be less. People tend to join less to the caregiver support groups, again, because I don't think they see themselves as caregivers, or that they don't feel that they have the right to be as upset or have all these feelings because they're not the one going through a cancer diagnosis. So we really do need to help caregivers see that it's so important. They need to, as I tell people all the time, you need to put on your oxygen mask on before you can help somebody else. And so if we're not giving to ourselves and we're not, supporting ourselves and thinking about all of our feelings, it's going to be that much harder to give to the person we love who needs our help and who's, the one who's diagnosed with cancer.
Do you have any advice? I wonder if somebody listening to this is a patient and or a caregiver, advice for them as a couple or as a family member, how to support each other and how to maybe navigate this. Maybe the person listening is thinking, oh, I wish I could have my caregiver get some of this, or the caregiver saying, I wish, my husband who's a patient. I mean, do you have any advice for them?
Well, I think it's human instinct, or not even human instinct, but I think what we do is we want to protect the people we love. So we don't want to burden them. So we don't share how we're feeling. And I think a lot of times people will even hide their tears from the people that they love, where I suggest that you show your tears, because you're modeling that it's okay to be upset and it's okay to cry, and that together, you can talk about this and in a way that can be helpful. But sometimes too, having support separately can really be helpful too, because you can be more open, maybe more honest, and hear how other people are doing, and even, tips and suggestions that I think are oftentimes shared in a group that you wouldn't necessarily hear from other people. And again, just like with a cancer support group, the caregiver support group, they really get this validation and they need this validation. And I think that gives them enough energy and strength to continue doing what they're doing, because in many situations, this isn't a sprint, it's a marathon, and it just takes so much out of us. So however people can be good to themselves, whether it's sometimes, we feel better after we exercise, but that's the last thing we want to do is exercise, when we're stressed. We can find so many other things, but even taking a walk or listening to some music, and we can have relaxing music or angry music, any way to just, get your feelings out. Sometimes just even going into the car and having some space away from family and friends, now that we can't really go anywhere, can help too. But I really would suggest anybody who's a caregiver who's listening today to reach out for support. This is so difficult, and all your feelings and emotions are shared by others, and really just being able to connect, I think, would be so important.
Yeah, and Stephanie, you kind of touched on something. I think reaching out, and one of the things I think can be so powerful for people is to recognize that what they're walking through is actually a shared experience that many other people go through, so that they don't feel quite so alone on the journey. And that's a really important component.
You guys bring up a good point. Even as an oncologist, as I reflect, many times, sometimes the most important role that we can play is actually to help have difficult conversations. And so just to sort of, when you first start practicing, you're trying to get all the technical things right, but later on you realize it's those conversations that you facilitate that are sometimes the most healing. And even being able to have a patient and a family member talk about something that maybe neither one feels quite comfortable broaching, but bringing it up, and there's sort of a moment of discomfort, but then it sort of releases into this really open space, and both at the end are like, okay, it's like the elephant in the room got named, we said the D word, and then now you can just sort of, it's in there, now it's just out, and now whatever that we were trying to hide is in the room too. So now all the patient, the caregiver, the oncologist, and death, we can all talk together, or we can grieve, or whatever it is. And so you're absolutely right. I found that the more you sort of protect, the harder the conversations become, and the more sort of openness. But there is, it takes a little bit of effort, and sometimes I think it's harder when you're right in the middle of the relationship to get that. And so I could see a support group or conversation with an oncologist or with a social worker, anybody to help facilitate that. The conversation is ultimately between the family members, but having sort of somebody on the outside move that can be helpful. I could see that.
I totally agree.
Yeah, that's really that's really important. I was going to ask you, we're sort of in this unique time with COVID and stuff. Have you found any experience that Zoom is working well and people are getting enough support through that, or?
Joe, I think for us, we found that there's been some good things around how we structure our classes and our groups and all of this. I don't think we'll quite always go back to what we did before. We thought we had to have this physical presence in order for these things to actually be meaningful for people. While I do know that it's great to physically connect, but places like Zoom to be able to host these classes are convenient, and people have the comfort of being able to do that in their home. So I think for us, being able to shift our offerings over into those platforms and still continue on has been a kind of a beautiful side effect in some degree. And then I think that we'll probably look at how to offer these hybrid modalities moving forward, because that seems to work for people and their busy lives. I don't know, Stephanie, have you found?
No, Kim, I totally agree. And at Hope Connections, I don't think we ever envisioned that we would do anything virtual. But now we see how well it works. I say Zoom is second best, but it is working so well. And we're actually seeing more people participating in our programs now that they are virtual, because people who weren't feeling well and weren't able to, get to us, their counts might have been low from treatment. The traffic is really hard, getting out of work on time, getting your kids fed for dinner. There's so many obstacles. And now that they can just join us from their computer, I think has really been so helpful. And we're also seeing people come to our organization who live out of state, people who've heard about us from the internet or from family and friends. And I even have some support group members who moved away and now are coming back to group. So that's really nice too, that we're able to provide services to more people in, all different kinds of situations. And we are in the process of getting audiovisual equipment put into all of our support group rooms, mind, body, classrooms as well, so that we can offer the hybrid, what you're saying, Kim. So when it is safe to come back in person, we want to open our doors and welcome everybody. But for the people who can't physically get to us for whatever reason, that they can comfortably join us virtually and still participate. So that is a silver lining for sure.
Yeah, definitely. Because I do know there's been, I think the other part for us that we're recognizing is, the pandemic has really taken an emotional toll on everyone. And now more than ever, the services that we're trying to build in these wellness programs, I think are going to be even more important. We always knew that they had this importance, but there's the level of isolation and change that everybody has been through over the past year. There's definitely a much greater need for these services for people. And we want to be able to let people know that we're here and we're available to help.
Yeah, I guess you're right. I mean, I see that with my cancer patients, that cancer itself makes people sort of feel isolated in some way, that they're different. And that's just accentuated by COVID. And so especially if you're an older person with cancer, and then now you're COVID, it's really like a triple whammy. So, and then Zoom is really quite an easy way to connect. And sounds like it's not awkward for people, is what I hear you guys saying, and they find it natural and they like it. Is that what you're saying?
Yeah,
I find that.
We found that too. Yeah.
Sometimes people need some help setting it up because they're not sure how to do it. And our office manager at Hope Connections, she's amazing, and she will walk people through it who haven't used it before. So I think some people who don't know the technology are a little hesitant, but once they understand it, it's very easy.
Definitely. And we, again, on one of our support staff, they help with all of that. And, we want to make it as easy as possible for people to take advantage of what we have.
We have a couple more things we can sort of think about winding down, but one, I was thinking about with the holidays coming, this probably brings up some special situations and times. Do you have any advice or comments for people around that? Stephanie or Kim, either one?
I think the holidays are always difficult with cancer in the mix. Now with COVID, I think even as you were saying, more so. I think sometimes too, it's people are finding COVID a little helpful in the sense that they can stay at home more easily. They don't have to go out and mingle as much. There might not be an office party they have to get to, or travel to go see family that they haven't seen, and now they're wearing a wig or they've lost their hair and have to sort of be on in a way that I think that right now that some of the feelings and concerns are a little bit less because that they have the buffer of not having to travel or to be in as many social events, maybe for the first time, and explaining their situation. But I do think that the holidays always, we all have expectations and hopes, for what we want it to be. And sometimes when it's not that, it can be difficult. But again, I just think open communication is, so important. Talking about how you're feeling, and even giving yourself permission to say, I need some time to think about this or process this. You don't always have to know exactly what to say, but just knowing that you have support.
Yeah. And Stephanie, I think that's one of the things that we really try to highlight too, is that people feel like they're empowered to make those choices or decisions, that if they don't want to go out, don't want to do something, it's really okay. And I think that sense of empowerment is really critical also, and that's something that we try to focus on. And really, I think in our education classes, it's really we give people tools on how to do exactly that, which is really critical. And during the holidays, when there's always this added pressure on for everybody, it feels like it's even more important than during your everyday life.
It's clear you both are very passionate about this work. You're not doing it as a job. It's something that you really care deeply about. That comes through. Well, we can start sort of thinking about winding down. If there's anything more that you want to say in closing, please do so, and then share your coordinates. Sort of where can people find you and find out more about your organization, and specifics like websites, phone numbers, and things would be great.
Yeah, for me, I want to just thank you for the opportunity to be able to let people know about what we're doing, about this great partnership that we have. And for us, people can find us on the Aquilino website, and that's probably the easiest way. And when our patients are coming through the door, any one of us down here on the first floor, pop in and say hi, we'll get you connected. Really simple. We want to make it as easy as possible for everyone.
What's the website, Kim? What is it? www.aquilinocancercenter.com?
Yeah, absolutely.
Okay.
Yep.
Stephanie?
Yeah, no, I want to echo what Kim said. Thank you so much for having me here today and just giving us the opportunity to talk about our passion, which is, cancer support and how important it is. Hope Connections, you can find us on our website at hopeconnectionsforcancer.org. And it's not the number 4, it's FOR, so hopeconnectionsforcancer.org. Or you can call us at 301-634-7500, and we'd be happy to just explain all of our services to you individually and talk through, how we could be most helpful.
Great. Well, thank you again, both of you, so much for your time and explanations.
Thank you.
Good night.
Thanks for listening to our latest episode of Oncology Radio. You can find the broadcast on Spreaker, iTunes, Google Play, Spotify, and iHeartRadio. You can find more information about our physician hosts from Maryland Oncology Hematology at www.marylandoncology.com. Subscribe to our show on Spreaker at www.spreaker.com/user/oncology radio. And remember to follow the guidelines and get your cancer screenings for the best defense against cancer.